Today is World Asthma Day, and as common as it is to many, there's still plenty that we need to learn about it. So we have our 9 News medical expert here to break it all down, Dr. Payal Kohli. Thank you so much for joining us today.
Good morning, Erica.
So we're actually just chatting a little bit, but before we get into it, how does asthma affect our lungs?
Yeah, it's really interesting. Think about our lungs like a tree. So the main trachea is kind of the trunk, and all the little airways are the branches of the tree. And you have two things going on in the lungs when you have asthma. The first is the lungs go into spasm.
Okay.
So those kind of branches get tighter, the trunk gets tighter, so air can't get in, and most importantly, air can't get out. So it's kind of like breathing on top of breathing, like holding your breath.
Yeah.
And then this triggers inflammation in the lungs. You get mucus production, you get clogging of those airways and those branches, and that can cause many of the symptoms that we know are classic of asthma, like wheezing, chest tightness, and shortness of breath.
We were just talking about kind of the differences in adults and kids and how it affects, and diagnosing can be difficult too. And I was sharing my story. So I have asthma, and when I was 10, I was training at an indoor track where the air quality is poor, and I had an asthma attack, and then went on to go through all the testing and get on medication. But had I not been exerting myself like that, we don't really know when I would have been diagnosed, because I wasn't having like day-to-day issues.
Right.
Yeah.
And that's the hard thing, especially in our kids. It can be a little bit subtle. So parents really need to have their radar up to watch for signs and symptoms. And you bring up a really good example, which is the air quality.
Yeah.
So sometimes, and asthma is episodic, so it's not there all day, every day. And sometimes when you go to the doctor, in fact, you can even have normal breathing and normal lungs. So what they'll do is they'll basically push a chemical into your lungs to see if they can induce asthma. It's called a methylcholine challenge, and sometimes they'll give you asthma medicine and see if the lungs breathe better with it. So it's really hard to know, especially in our kids. But if you notice that your child is getting a little more short of breath, a little wheezier, especially in certain environments like indoor spaces, when there's a lot of air pollution outside, when there's mold around, those types of things, talk to your pediatrician about getting tested for asthma.
Nothing scarier than an asthma attack. We certainly don't want that happening to anyone. So what are other ways we can tell if we might have it as an adult? Maybe we've never been diagnosed.
Yeah, I would say nighttime coughing.
Okay.
So that's a subtle one that sometimes people miss. And what can trigger that is often a little bit of silent reflux. So little bits of acid from our stomach can come up into our lungs, and that can trigger that spasm in our airways, and we can cough. But if you go up into the mountains and the cold, dry air seems to trigger wheezing or coughing, that's a sign that you may have asthma. If you exercise, just like your story you pointed out, exercise-induced asthma is a common phenomena. Some people need a little albuterol to relax their airways before they exercise. In our kids, strong emotions, even in adults actually, you're upset, you're fighting with somebody, you're angry, you're crying.
Elevated.
And that triggers your asthma, exactly. So, and then strong smells can do it as well. So you have to be really careful about perfume, and really strong smells can induce that reactivity in the airways.
Yeah, and you were talking about elevations. When I, moved here from, lower normal elevation coming here, I really had to ease into training. I could feel it just walking around. So there certainly is a sensitivity here, I think.
There really is. And even for people who don't have asthma, actually, coming to altitude can certainly be a little stress test for the lungs. But then when you have asthma and you have cold, dry climates that can trigger it, you have different kind of, our pollen and our trees are different here because of the altitude than it would be at other climates. That can certainly trigger it. And then for some people, it's also occupational exposures. What types of things you might be exposed to at work, what type of environment you're working in. But if here in Colorado, we certainly need to have our guard up because we have less oxygen in the air. So an asthma attack here can progress more quickly. And it can, because of less environmental oxygen, it can actually be worse. Now, very rarely people die from asthma, but it certainly can be fatal. So it's not something we should take lightly.
And if people aren't treating it, it can get a lot worse. Like you were explaining, the airways and all of that. And you can have permanent damage if you're not on a medication, and you should be. That's what I've learned from my doctors. They're like, you need to stay on it, Eric.
That inflammation can cause scarring. That chronic bronchospasm can cause changes in the lungs. It can pop open lungs because you're trapping air in your lungs. So you can pop open the balloon that is our lungs. So you really have to talk to your doctor. If you think you have asthma, don't just use the rescue. Sometimes people really need something every day, because the idea is to have something for control all the time, not being reactive, but actually being proactive.
Right, absolutely. So, I mean, I've seen my allergist has treated, my pulmonologist. Who's going to be the best person to go to for any concerns with asthma?
Your primary care can do it, your allergist, your pulmonologist, but it brings up the issue that asthma is a complex disease. And if you have a lot of allergies, you may have a little bit of asthma.
Totally.
Those two sort of tend to run together.
Yeah.
And there are wide different types of doctors that treat asthma, because because it sort of affects so many different
things.
systems.
Yeah.
Yeah, exactly. But the most important thing is to recognize it, get it treated. And if you're not sure, it's a simple breathing test.
Sure.
They do a test
Yeah, it's
called
very
spirometry.
easy.
Yeah,
I've
you
done
blow
it.
into
Yeah,
the
just
tube.
blow in, and then, like you said, give you a little puff of the inhaler, and you check and see if your levels increase.
That's right.
So, Dr. Kohli, thank you so much as always.